Hi, my name is Ruud Sips. I'm a general dentist. Today we're going to show you and demo you how to use the scan body we provide you. If you're looking to the pieces you need for this, it's the scan body, which comes with the carrier on top. I will show it in a minute to you, which is a package non-sterile, and it might be useful to use the extender. This is for cases where the implant is placed quite deep. And in that case, you can really make the scan body longer with approximately a little bit more than 5 millimeters. So this is actually the only things you need. You don't need any screwdriver, so that makes it easier. I have here a demo model and I'm going to remove the soft tissue part so that you are able to see it more easily. And then we're going to open up the package of this scan body. Again, which comes with the carrier. So actually, this is the whole piece. First of all, the scan body, and secondly, the carrier. And there's no screwdriver on top. It's just flat. We will demonstrate it later on. And what is important is that if you look from the upper side, you see a point, a direction point, and that point needs to go to the buccal of the implant. So when I demonstrate it, I'm going to put it on, and then you feel the regular snap if it's an internal hexagonal, and then just screw it on, just with your fingers, and then actually when turning, you feel that the carrier comes loose, and you just can pop it off. That's it. Now you can see that there's no screw hole on top. It's really the carrier who makes sure that you screw in this scan body. Well oriented with it pointed to the outside, and this is it. Of course, you can make an X-ray to check the seat. We would like to recommend that, of course, to do. And then just for demonstration, I will show you also the extender. That's this little piece. And you just can feel and snap it on top there where you also see that it will fit into that same spot which you oriented just to the buccal. So you will see that it just can turn on in one direction so that it fully completely seats. And now you see that you prolonged the whole situation, and that might in those cases be necessary where the implant is very deep. For removing, you just can use the carrier again to unscrew, and you can remove the part. And what is nice to know is that you really can do the unscrewing further. So now I'm pulling a little bit, and now I really unscrew the whole item in two pieces. And the reason why you are able to do this is for cleaning purposes. So now you are able to clean both parts. If you want to push it back in, realize you need to screw it back in until the first fit, and now it's really loose, and now you can just put it on the implant back again. So this is everything actually you need to have. No screwdriver, easy to use, good orientations, and the properties of the scan body will help you scanning the implant position very accurately. The surface of these scan bodies are sandblasted, so the scanner will recognize the surface easily, and because of all the geometrical performance of this scan body, it's also easy recognizable by your scanner. So this is actually what I wanted to demo you today, and I think you've seen a very useful and easy to use product which can help you scanning your implant case and make sure that you have a proper registration. Thank you for watching this demo. If you have any questions about this unique scan body, please contact our implant support team.